Okay, as people are still joining, we are going to go ahead and get started. Um, Hi, my name's Heather David. I am the Alumni Relations Coordinator for NOLS, and I want to welcome you to the second NOLS Wilderness Medicine virtual event in the series. Thank you so much for making these events such a success by joining us. Um, Before we get started, I'm just going to go over a few logistics. First, these events are recorded, and the recordings will be shared at the end of the full series. In order to make these events more accessible, we have an ASL interpreter, and there is closed captioning turned on for all. During the presentation, Jim will be sharing his slides. Um, if you click in, if you click in the middle, there's a vertical gray line, and if you pull this to the left, it will make the presentation smaller and the speakers larger. And if you pull it to the right, the speakers will be smaller and the presentation will be larger. So use that feature to kind of make that work best for you. At the end of the presentation, Jim will be answering some of your questions from the Q&A. Feel free to add those questions as they come up for you. We do have a few other NOLS Wilderness Medicine team members, Graham, who will be presenting next Thursday, and Robin Larson, whose birthday it is today. So they will be answering some of those questions, just typing them as they come up. And then Jim will answer them verbally if anything hasn't been answered by the end of his session. Without further ado, I would like to introduce Jim Wynn, who is the NOLS WEMT Program Specialist, to share some tips and tricks for blister management.
Thank you, Heather. And hello, all. Thank you so much for inviting me here. And greetings from beautiful Lander, Wyoming. We're going to spend about the next half hour or so talking about blister care, how to prevent them, and how to take care of them if and when they do, in fact, form. But just a few things about myself here. Second, there it is. So my name is Jim. I am the WEMT Program Specialist, Wilderness Medicine faculty, and a Wilderness EMT. Before joining the WEMT program, I was a wildland fireline EMT, where I would see a significant amount of blisters. So, just a side note as well, I have peppered this presentation with multiple pictures of blistered feet, some more intense than others. So, ye be warned as we get into this. So, two pretty simple truths about blisters. Blisters are universal and blisters are not inevitable. If I asked you to raise your hand if you had never had a blister, I think it would be safe to say that there would probably not be too many hands raised. In fact, I would say one thing that we all have in common is that we have all had at least one blister in our lifetime. They're pretty common, but it's these common and simple issues that can compound if we don't stop and attend to them if we need to. And the second truth about blisters is that blisters are not inevitable. That being said, I do not expect that by the end of this presentation, we will have eradicated blisters. That's okay. But if we could live in a world where there is just one less blister out there, I think we will have accomplished great things here today. Because while blisters are universal, if we know how to recognize when we're getting them and stop to treat them, then we don't have to accept blisters as an inevitable part of a backcountry hike. So, blister care is preventative care. We can all be, myself included, very reluctant to stop and take care of hot spots and blisters when we need to. There's a lot of reasons for that, but four of the big ones are Maybe we get summit fever. We just can't wait to get to the top of that peak. The sun is going down and we need to get up to the top and back down again. And so if we don't take the time that we ought to stop and treat our feet, we can say to ourselves, it's only a few more miles to camp. We'll just deal with it when we get to camp. We can say to ourselves, a blister is no big deal, which that is not true. Or the worst of all, we can try to break in our brand new boots that we just bought on the trail itself, which is a terrible idea. Okay. So the fact that one small blister may not seem like a big deal, if we don't stop and take care of it when we need to, the blister is going to get bigger. And the bigger that blister gets, the more damage has been done to the skin. And if you let a blister get bigger and bigger, it's just a fact that that small blister that you didn't stop to take care of could become an injury so severe that it could end your trip and may even go so far as to require an evacuation. Do you feel like I am being a touch dramatic? I am not. And I can't see the faces you're all making, but if it's one of horror, I think that's probably the right face to make. And I don't know the exact circumstances here, but I feel pretty confident in saying that this person probably should have stopped and taken care of this blister a long time ago. For whatever reason, they didn't. And now it's a pretty significant injury. And this person probably isn't able to walk on that foot. And if we are miles into the backcountry, that is going to be a problem. But it's okay, because that's never going to be us, right? Because we are going to stop and take care of our blisters. So a little information about blisters, or blisters 101. A blister is a bubble of fluid, typically clear, that forms under the top layer of skin. Blisters form when friction stretches the skin, creating a tear between skin layers, which then will fill with fluid. When we talk about blisters, well, a blister is an injury that needs attention. The cause of hot spots and blisters is what we call shear friction. So I'd like for you all to indulge me for a minute, if you will. Everyone go like this. Go like this. I'll go like that. So that is heat friction. That is not the actual cause of blisters. Let's go like this. Take our finger. Let's go like that. Start moving that finger around in one place on the top of our hand. So that is shear friction. That is the actual cause of blisters. So when we feel those hot spots or blisters coming on, our treatment is to reduce that friction to prevent further injury and promote healing. Let's recognize that sometimes, despite our best intentions, a blister will form. So no need to be panicked, because we are always prepared for blisters. One key element in any worthwhile first aid kit is a well thought out blister kit. These don't have to be extensive. You need something to prevent friction, you need something to protect the blister, and you need something to keep it all in place. Once you have those things, triple them, because blisters generally run in pairs. So what I have here, this is my blister kit that I have assembled, and this goes with me on every backcountry excursion I take. I'm going to show you some of the things that I keep in my blister kit. This little vial here, this contains some very important tools for blister care: a pair of tweezers and a safety pin. We'll get to why I have this safety pin here in a minute, but that is a critical piece of your blister care kit. So we need something to prevent friction, right? Moleskin, fantastic stuff to keep in your blister care kit. There's many other things out there on the market. This here is Bursatec. Bursatec is essentially a blister Band-Aid. It just goes right over the top of the blister. I have some Second Skin moist burn pads. Let's take a minute to look at these Second Skin moist burn pads, because I would highly recommend putting some of these in your blister kit. This is essentially medical grade jelly. It's a very sticky, moist substance. That works well for any kind of open blister. It keeps that friction down, and it keeps the open wound of your open blister pretty moist. When it comes out of the packaging, it has 2 sheets of plastic on each side. So you need to pull one of those sheets off. And then this sticky moist side is the side that goes over the injury. Another great thing to have in your blister care kit, some KT tape. KT tape is wonderful stuff. It is made specifically to go onto the skin. One great thing about KT tape, as you'll notice, is that it stretches. So it's very good for forming over our feet or over our hands. Another great thing to have is this right here, this Hypafix. This is another type of tape that's really good for fixing hot spots. So that's my blister aid kit. Just some tips and tricks for you to begin assembling your blister aid kit. Okay, we're going to talk about hot spots. The thing about hot spots is that they should not be shrugged off. Hot spots are already a problem and an opportunity to prevent a blister. So when we start feeling hot spots, what we're going to do is we're going to find the point of friction, and then we are going to reduce that point of friction. To reduce the friction between the skin and the cause of the friction, we just pad the area with moleskin or some of our tape that we love to use from our blister kit. There are so many different types of tape out there. Not only are there so many different types of tape, there are so many different types of blister care kits. One thing that we want to do is we want to consider the tape we are using and if it can tear the skin on removal. If we think it could potentially tear the skin on removal, then we're going to consider putting something between the skin itself and that sticky adhesive tape. There's all kinds of paper tape out there that you can use that works really, really well. And one thing to note is when it comes to hot spots, we don't necessarily need to tape every hot spot. What we need to do is find what's causing that point of friction. Is it a rock in the boot? Is it a sweaty sock that is bunched up? A common phrase that we like to say here is that medicine happens at the skin level. And what we mean by that is we need eyes on what is causing that friction or that injury. We might need to tape it, or we might just need to spend some time in camp with their boots off. It just kind of depends on how that hot spot is forming and where it's located. Speaking of all kinds of tape, this is just a smattering of the tapes out there available to you. Like I said, KT tape is my go-to tape. I think it's a wonderful type of tape because it is specifically made to stick to skin. There's this 3M micropore tape out there. This is also good stuff, and you can't go wrong with having a little athletic tape in your kit. The difference being these here are industrial tapes. This Hypafix and this KT tape, these are made exclusively to go on skin. So I would recommend having one of each in your blister care kit. Which one? Well, that's up to you. Okay, some taping tips and techniques. The first thing we want to do is cut the tape to fit the anatomy. I think it's pretty fair to say that the human body is not exactly one of hard angles. So typically, though, tape comes in right angles. So as a result, we need to plan on where we put in the tape and trim to fit the tape to the specific area. We want to clean and dry the skin when we're replacing the tape because, of course, as we all know, adhesive and moisture don't mix. And then we're going to place the tape over the blister pad. I'm sorry, over the hot spot. We realized that it would be a rare person who would stop to tape up a hot spot and then sit idly by, letting that tape settle in. So ideally, though, you want to wait at least an hour before you resume your hike. We realize that that is not always practical. Rub the tape for at least 20 to 30 seconds, and that will activate that adhesive. Something to consider is that the longer you let the tape settle, the longer it will stick. So one pro tip is that it's not about more tape, it's about tape placed well. Proper tape placement is hands down more effective than using half a roll of tape. The more tape we use, the more problems we are creating for ourselves. That foot still has to go back into the boot, and the more tape you have, the more difficult that will be. You're actually just creating more opportunity for shear friction. Graceful, elegant, practical taping is the way to go. So let's look at taping a hotspot. Let's say our hotspot is right here on that foot, or on that big toe, where we find our favorite way to tape and our favorite type of tape. Mine is this Hypoflex. I have pre-trimmed this tape for presentation purposes. We're just gonna wrap the tape all around where that hotspot is. Right. We want to use as much tape as we need in order to ensure that it won't come off. But again, we're not going to over tape here. So one thing of tape around the toe itself should be enough to cover up that hotspot. We can oftentimes get hotspots in the middle of our toes or between our toes. We can handle this. Again, KT tape, it's good stuff. We just cut out a little dumbbell of that KT tape. Slide it right in between the toes. And we can prevent that hotspot there from forming. That's hotspots. Let's look at intact blisters. So we have missed the warning signs of the hotspot, or the hotspot got worse even after taping and a blister has formed. Typically, a hotspot will form first, and a blister will be soon to follow. So when we have a blister, remember we have that tear in between those skin layers and that fluid leaks into it. We could have a situation where we have a blister that we may need to drain. When we think about draining, we're going to look at a couple of different things. One is that draining a blister turns a closed wound into an open wound. As a general rule, if that blister is larger than a nickel, we should consider draining it. And this is to control the chance of infection. Leaving a blister intact could mean that it could pop or burst inside a dirty, sweaty sock filled with bacteria. And then we have compounded our problems. So to drain a blister, what we're going to do is, you can see my setup here, clean the blister and the area around the blister with an alcohol pad or clean potable water. And then you remember I mentioned my safety pin? This is where that safety pin comes in. We're going to use a needle or a safety pin to pierce the bottom of that foot. One thing that we want to do is make sure that that is sanitized in a sanitary end to that needle. You can do this a couple of different ways. One of the best ways is to include in your blister kit or your first aid kit some sort of antiseptic or alcohol wipe, where you just wipe the edge of that needle. Good enough to get any bacteria or germs off of it. And then once you have it clean, we're going to drain from the bottom or the base of the blister. The best practice is to place a blister in such a way that we let gravity do most of the work for us. So we want to position the foot in a way that gravity will pull that fluid out. One thing that we want to note is we want to leave the roof of that blister intact, as it creates a barrier and can help the healing process. So when we go to pop this blister, right, just gently insert the needle in the bottom of that blister, pull it back out again, and then that fluid should start draining. Hopefully we have a gauze pad with us where we can just kind of help that fluid on its way. And we want to clean that up and not try to tape over it, because as we said before, adhesive and moisture just don't mix. We consider a blister that still has the roof on it an intact blister. So whether it is drained or not, if it has the roof intact, it is an intact blister. So let's look at how we treat an intact blister. Let's say that this is our intact blister. We're going to protect it and prevent the rub. many, many different types of blister products out there. I see nothing wrong with just using a good old-fashioned piece of moleskin donut. Put that over the top of the blister to protect it from further friction. And then, of course, we're going to need to tape it. And as I said earlier, my favorite tape in the whole wide world is KT tape. When securing that mole or the donut hole in place, we don't want to over tape, right? But we want to make sure that that blister pad is going to stay in place. So using our KT tape, we're just going to wrap once around the foot. You may need to trim a little bit off the bottom of it, but that amount of tape should be good enough to hold that blister pad in place. So let's talk about open blisters. Oftentimes, the roof of the blister has ripped off, and now we have a large area of exposure. An open blister should be considered an open wound. And so we're going to clean any open blister as infection can rapidly set in, particularly if you're putting that open wound back into a dirty, sweaty sock where bacteria love to fester. So if we have an open blister, we're going to pad or cover the open blister with our favorite blister pad. And then we're going to cover our favorite blister pad with our favorite adhesive tape. Let's look at an open blister that is on the heel, because heels take a little bit of special consideration when we go to finalize the taping part of it. So this is an open wound. We're going to have to protect that a little bit more than we would an intact blister. Going back to good old-fashioned moleskin. Again, this is my favorite way to treat a blister. That moleskin is going to go, of course, around the blister itself. And then because we essentially have an open wound, I'm going to grab my second skin or my moist burn pad, and I'm going to put that right over the top with that moist, wet part down towards that open blister. Think of it as kind of a jelly donut. Right? It's going to protect the blister, but it's also going to protect that open wound from drying out. And that way it's going to promote healing a little bit better than if we just left it dry. In dealing with a heel, when we think about cutting our tape, because of the way that the heel is sort of rounded, we're going to have to cup that roundness. So I have taken KT tape and I've cut these two little notches on each side. And these notches serve a pretty important purpose. Put the KT tape over, put those first two notches down. Then we take these notches and bend them up. To cover that tape. Now we have covered our open blister with our donut hole and our second skin, our moist burn pad. And then by using those notches in that KT tape, we were able to cup the heel in a way that we feel pretty confident it's going to stay right where it should. That's open blisters. And again, there are many types of blister products out there, and you certainly don't need them all. You just need to find one that you like and carry it with you. These demos that we have shown here are just a few examples. There is a world of blister care out there, and it's not so much that you have every one of them, it's that you know how to use the ones you have. So, couple of things. Only you can prevent blisters. We're not going to be stubborn when it comes to our feet or our hands or anywhere where we might be getting a blister. Particularly because if we were in a backcountry setting where we're hiking many miles, we need our feet to get us in and to get us out. So we're going to check our feet, and we're also not going to be shy about checking our friends' feet. If we see one of our friends on our hiking trip hobbling into camp, we're going to ask them to sit down and we're going to take a look at their feet. Know your footwear. Don't break your boots in on the trail. Give them a good 2 weeks of breaking in before you head out. Again, invest in good socks. Socks can be your friend against that sheer friction. Dry feet are happy feet. Our feet don't like to be moist. And so if we feel them to be excessively moist for some reason, then we're going to stop and we can dry them out. If we just got done with the river crossing, it's worth the time it takes to take off our boots, empty out any water, and wring out our socks before we put them back on again. Assemble your favorite blister care kit, know how to use it, and blister care with confidence. So that's pretty much blister care. If there are 3 things that I'd want you to take away from this, I would say it's this. Blisters happen to us all. We need to recognize that if we don't stop to take care of blisters, they will become a bigger problem. And we can only take care of blisters if we have the right tools to do so. So start assembling your blister kits. Any questions?
Hey, Jim. A couple of questions. One that I've seen is a lot of people asked if you could review the items for blisters in your first aid kit.
Sure. Yeah, let me assemble them together again. I have them all spread out. 1 second. So one of the things that I highly recommend carrying with you is this second skin here. This is a moist burn pad. This is wonderful stuff for open blisters because it keeps that open wound moist. There are many different types of these items out there. This is Versatech, and here, I'll open this up. And again, this is essentially a blister Band-Aid. Not sure if you can see that, but it essentially, this is where you put the blister, right? And then this is the adhesive that goes over the top of it. So this is kind of a ready-made blister care product that works really well. This tape that I have here is Hypaflex. This is a paper adhesive. It's very soft, it's gentle on the skin, and it's really good for hot spots that are mild at this point. Of course, anytime you have a blister kit, you need to have some moleskin in there. Moleskin has been used for a long time for blister care, and there's a reason behind it because it's really good stuff. And then, of course, our KT tape. KT tape is one of the best things that you can have, not only with you in a backcountry setting, but for blister care. This is really good stuff. And also it comes in a variety of colors. What else do I have? Oh,
And yeah, keep going.
get this. Don't forget that safety pin. So you have a way to pop that blister if you need to.
Awesome. Another question is, how do you decide like when to quit the trip or hike out early?
Ooh, well, that depends. And that's going to depend on many different things, but I think it's going to come down to is it's going to be up to the person who has the blister. And if they have a blister so severe that they can't walk on it, then I think it's going to be their call to say, I can't continue this trip. It's time to go. So it's going to be specific to each situation. But if someone can't walk on their feet, then there's really no sense going forward.
Awesome. Do you keep the blisters covered at night? Or is it better to expose them to the air to like help dry them out?
Oh, good question. I think so one of the things that we do, why we do blister care this way, is to reduce that point of friction. I think that if you're in camp at night and you no longer have that point of friction, that it's fine to leave them uncovered. Knowing that if you have to get up in the middle of the night for whatever reason, and you have that uncovered and you put it into your boot, it's going to potentially aggravate the situation.
Awesome. Someone else mentioned that having tweezers in your blister care kit and asked kind of what those would be used for.
Oh, yes. Good question. Those aren't for blisters. This is just a great place to keep them. So I always know where the tweezers are in case I need them.
Perfect. What else? A couple questions around allergies to KT tape. and if people are allergic to them, what a good alternative would be.
If you're allergic to KT tape,
Yeah.
a good thing is just good old-fashioned athletic tape. Again, I'm not sure what the allergen would be in that KT tape. I personally, I don't know what that is. So whatever that allergen is, just find a tape that doesn't have it. Usually this 3M micropore tape can be pretty allergen free. It's going to be individual to the person.
Awesome. And a question about what you do on your hand if you had a blister as opposed to your feet, like if there's a different course of action.
There's not, no, we find the point of friction,
Okay.
reduce that point of friction.
Perfect. What else? Another question is if you have a preferred method for cleaning an open blister.
Well, let's see. If we're going to clean an open blister, that skin is probably going to be pretty raw in there. And so we certainly don't want to put alcohol on that open raw wound. The best thing that we can do is do our best to clean around it to help keep some of that infection or bacteria or whatever it is away from that open wound itself. And then if the patient can tolerate it, then I think we can use clean water to try to clean off some of that open wound, open blister.
Perfect. And a lot of questions also about using like antibiotic ointment, and if that's something that you recommend for blisters and just carrying with you in your blister kit.
I would not recommend using antibiotic ointment on a blister. It's just a sort of different type of wound than maybe a cut or laceration, something like that would be. We want to keep it clean. We want to reduce that friction, and we do that by using our favorite blister pad and our favorite type of tape.
Perfect. And I think the final question we have time for is just if your course of action for blisters is similar to your course of action for burns.
Okay, so that's a tough one to answer without going into a burn class. I would say that when dealing with blisters is sort of a whole different style than dealing with burns themselves. Yeah, so that's a difficult question to answer. I would not treat a burn the same way that I would treat a blister.
Awesome. Thank you so much to everyone for coming to this event. I did see a couple of questions around if this is recorded for people who joined a little bit late. Yes, this video and session is recorded, and it will be sent out in a follow-up email after all of the events are done. Our last one is occurring next Thursday, May 2nd at 3 p.m. Mountain Time again. This event will be focused on the top items in your first aid kit and will be led by Graham, who was on this call helping to answer some of your questions. Thank you again for attending and just making this event so successful. And a huge thank you to Jim for a great refresher today on blister management. All right. Thank you so much.
Yeah, thank you all.